Hello, everyone, and welcome to today's Health Talk. We're going to discuss something we all experience at some point, a fever. But what exactly is happening in our bodies? A fever is much more than just feeling hot. It is a complex biological response. Today, we'll cover what a fever is, its function, and explore some specific types of prolonged fevers that doctors monitor. A fever is a temporary rise in body temperature, typically defined as a core temperature above 100.4 degrees Fahrenheit or 38.0 degrees Celsius. To understand fever, we need to talk about your body's thermostat, the hypothalamus. Crucially, a fever is your body's natural defense mechanism, working hard to fight off infections caused by bacteria, viruses, and other pathogens. When foreign invaders are detected, the body releases, quote, pyrogens. These travel to the hypothalamus, signaling it to raise your body's temperature set point. This is why you might feel chills or start shivering. Your body is trying to generate heat to meet that new, higher temperature set point. Now let's talk about a few specific types of prolonged fevers that require medical attention. First, there is typhoid, or enteric fever. This is a prolonged febrile illness lasting over 10 days, caused by Salmonella bacteria, often transmitted through contaminated food or water. Next is a special medical classification, PUO, or pyrexia of unknown origin. This is a persistent fever of 101 degrees Fahrenheit or higher, lasting more than 3 weeks without a clear diagnosis despite thorough investigation. Doctors categorize PUO into a few specific types, primarily based on the patient's condition and environment. Nosocomial PUO occurs when a hospitalized patient develops a fever not present when they were first admitted to the hospital, meaning the infection was acquired within the hospital setting. Neutropenic PUO is seen in patients with a severe lack of white blood cells, specifically a low neutrophil count, leaving their immune system significantly compromised. Finally, HIV-associated PUO refers to a prolonged fever occurring in patients living with HIV, often complicating their ongoing medical management. Now let's quickly discuss what you should do if you develop a fever. For general management, remember to get plenty of fluids, use tepid sponging to cool down, and take over-the-counter reducers like paracetamol following the recommended dosage. However, if your fever lasts for more than a few days, is accompanied by severe symptoms, or if you fall into any high-risk categories, you should always consult a healthcare professional for a proper diagnosis. Remember, a fever is just a symptom, a sign that your body is hard at work protecting you. Thank you for tuning in to today's Health Talk. Stay hydrated and stay healthy.